We know that breastfeeding provides the best possible start in life for your baby, but we recognise this might not be possible for everyone. Formula feeds contain some vitamins and nutrients that babies get from breast milk, but they do not have the germ-killing proteins found in breast milk, which helps to fight infections and illness. Feeding time can be a great opportunity to bond with your baby. Bottle feeding allows your partner to enjoy this experience too, but it can take some time for you and your baby to get used to the bottle. To make up a formula feed, you will need bottles with teats and covers, formula milk powder or sterile ready-to-use liquid formula, and sterilising equipment. Always start by washing your hands. Although it's very rare, powdered formula can sometimes contain harmful bacteria that can make your baby very ill. In order to kill any bacteria that might be present, always use tap water and boil it before letting it cool for no more than 30 minutes to about 70 degrees. Don't use bottled water or use water that has already been boiled, and don't boil water in advance and store it in sterilised bottles. It needs to be hot when the formula is added to kill any harmful bacteria. Sit somewhere where you're comfortable. Place your baby on your lap while supporting their head so they can breathe and swallow safely. Sometimes babies suffer from reflux or colic, and for these babies it's important to have them as upright as possible to help minimise their discomfort. Your baby should never be flat during a feed, as this increases the risk of choking, and you must always hold the bottle. Do not prop it up against a cushion. Make sure you have the correct size bottle and teat for your baby. Ensure the milk isn't too warm by testing it on the inside of your wrist first. Begin by gently touching the teat of the bottle against your baby's lips while holding the bottle upwards. Your baby will open their mouth, and this is when you can carefully place the teat inside. Never force the bottle into your baby's mouth. Now that the teat is in the mouth, you need the bottle to be horizontal so that the teat is full of milk to stop your baby from swallowing air. This might cause them to have tummy pains. You may sometimes notice that the teat goes flat against your baby's mouth. You need to break the suction between the teat and your baby's mouth. Do this by gently sliding a clean finger between their gums and the teat. Some babies take a while to get used to bottle feeding. It might be worth trying different teats, changing position, or trying to feed your baby little and often to get it used to it. There are different ways of sterilising equipment, including cold water solutions, steam sterilising, and sterilising by boiling. Whichever method you choose, remember to wash your hands first. Clean the bottle and teat in hot soapy water after feeding and rinse with cold water before sterilising. For more advice on feeding, please talk to your midwife, health visitor or GP.